Welcome, friends, and thank you for tuning in to the Optimal Health Program. Yet another excellent episode. We have a lot of great information to cover. We have a wonderful guest today, Dr. Malura, who's been in the hair restoration and transplant realm for the better part of 30 years, 30 plus years. And we were looking at statistics the other day, and certainly when we'd spoken to him and asked him to come on the program, and we were thrilled the fact that he has time to do this, there are well over 650,000 people worldwide who have these procedures done. There are different types of procedures. There are places to go that are good and safe, and there are places to go that may not be safe or good. And we're going to cover all the gamut, what causes hair loss, difference between the different techniques of hair transplant, and let's just go directly to it and bring Dr. Malura on. Thank you for coming on the program.
Thank you for inviting me.
Oh, it's a pleasure.
My pleasure.
My pleasure as well. So, I'm have always been curious as to, trends and things, and I think that over time, more and more men and women are having issues with their hair, whether hair loss or thinning. Do you think there's something that is behind this that's besides the typical, maybe genetic or androgen-related hair loss for men, that it's allowing people to lose their hair more so than before?
Well, I will say that there's definitely more awareness now in the last several years than there had been before. I mean, earlier, 20 years ago, 25 years ago, very few people even knew about hair restoration surgery, and very little treatments. And one of the few treatments was minoxidil, and then another treatment that came out about 22, 23 years ago was the finasteride or Propecia from Merck. So there's been a lot of awareness in the last 10 years, let's say, with more and more people getting into the hair restoration business than there were prior, worldwide, that is, not just in the United States. And as far as women, where we never hardly saw any women, I would say maybe 2 or 3% of my practice on Madison Avenue in Midtown Manhattan, we would see maybe 2-3% of women in the practice, and the rest men. Now I'd have to say that probably percentage of women has gone up in my practice to about 30-40%.
Wow. That's
so there's definitely much more awareness. I don't know that there's issues that are causing more hair loss than there were prior. There could be. I mean, there are certainly various conditions that cause hair loss, and the most important is really androgenetic alopecia, or a genetic component. But especially in women, there are many reasons other than just androgenetic alopecia. In women, basically, what we do is we'd like to refer people to get blood tests, see a dermatologist, and have a whole bunch of blood tests being done, whether they be with the CBC and ferritin and thyroid and so on. And we want to make sure that they're healthy and don't have these issues that could be causing hair loss. And sometimes when you do these tests, you find out that there are other medical issues other than hair loss involved. So we are seeing more women, to answer your question, and we try to make sure that we get to the root cause of the problem. And certainly a lot more women are going for hair restoration surgery these days than before.
Yeah, it seems that thyroid decline, even estrogen, progesterone, IGF-1 decline, have a correlation, with that. But
right.
Yeah, it's curious. It seems to be more and more so. How do hair transplants, in the different techniques that you've seen and done, how do they work?
Okay, well, just going over real briefly history, I'll say that hair transplants really started by a Japanese physician before the war, where he did some research, wrote papers, and then the World War II came and it got buried and nobody saw these papers. After the war, a doctor from New York, actually, that came across these papers and started doing some research and started doing that was the birth of the plug sessions, which are horrible sessions to begin with, because each plug would have 15, 16, 18 hairs. And they would look good when you had other hair around it, but as patients started to lose more hair, then it became like a doll's look. Mm-hmm. Anyway, going further forward than that, we started making the grafts smaller and call them mini micrografts. And from mini micrografts, we went into follicular unit transplantation. Follicular unit transplantation is actually taking a follicular unit, which can be composed of 1, 2, or 3 hairs, and sometimes 4 hairs in a grouping with a gland attached to it. And we make little tiny incisions on the scalp following the direction of hair, the angle of the hair, and we transplant these follicular units in these incisions. And because we're taking hair from a donor area that's genetically sound and not affected by DHT production, which we'll talk about in a second, then this hair will grow. And that's the fundamental part of a hair restoration surgery. Now, whether we get these from a strip surgery, because in years past, it's funny how we went from plugs to strip surgery, and now we have, again, tiny micrografts that can come from either a 0.8, 0.9, a 1 millimeter tiny circular incision in the back of the scalp, much, much smaller than the 4 millimeters that were done years ago, so that you can get natural follicular units out of doing an FUE procedure, and transplanting those. So today you have 2 procedures. Today you have the strip surgery, which unfortunately a lot of times on the internet is referred to an old-time surgery, and it is not. It really depends on the patient and many of the factors of that patient, whether one procedure is better than the other. The FUE procedure is a procedure where we have to shave the back of the head and we punch out, as I said earlier, with tiny punches, these follicular units. So it's either going to be a linear scar or it's going to be thousands of these tiny little punches. But the result is the same once we transplant them to the top of the scalp. So that's the main difference between the 2 procedures, either a strip surgery or an FUE procedure. And the FUE procedure is a great procedure, but the FUT procedure or strip surgery in the right patients can be even a better procedure. So you have to know how to do both procedures, and you have to know pretty much how to do all the procedures for hair restoration. Unfortunately, many of the practices that are open today only do one procedure because that's all they can handle. That's all they know how to do.
What about training today? There's a question as to whether or not, in other countries, because people for some reason want to go to other countries because it seems to be less expensive to have some of these things done. What about the training? You'd think that in other places the training would be as good as we would have here. Well,
unfortunately, the training in other places, in many other places, is not so great to begin with. I know of physicians that go for, a day's training with some doctor and then trying to do the procedure themselves. Unfortunately, a lot of these places don't get great results, obviously, or sometimes they shadow a doctor for a couple of days. Basically, I'm part of an international group called the International Society of Hair Restoration Surgery that's been around for over 30 years. And I'm part of the ethics committee for that international society, so I see a lot of what goes on in other countries. But I also travel quite a bit and teach. And what we do is we have sessions where we spend a week, for example, in the operating room teaching these procedures to doctors that are interested in doing hair restoration surgery. Mm-hmm. and we do multiple patients and have them hands-on. And that's how we teach, internationally when we have our international meetings once a year. So we have workshops. The procedure itself requires a lot more than just knowledge of how to do a hair transplant. It requires pretty much you knowing angles, directions, hairline design, all these different factors that come into play. So it's much more than just
it's more complicated, sure.
Of just knowing how to do the procedure itself, but also how to treat people with hair loss, what tests to do, and so on. So it really becomes a little bit more difficult, to do that in a short period of time. You really need a good solid month of teaching just hair restoration surgery, and all the causes and how to treat.
So whether it's for women,
to answer your question, I'm sorry.
You're good.
To answer your question about different places around the world, as you know, Turkey for the last 10 years has been pushing. And they're getting patients from all over the world to come to Turkey. And the basic reason for that is that they're very inexpensive. They're about half the price of what you can get it for in this country. And the problem is that in Turkey, they do approximately, from my understanding anyway, is that they do approximately 1,200 patients per day in all of Turkey.
Day. Wow.
Per day. Because they get people from Europe, they get people from Asia, they get people from the United States, based on the prices. Labor is extremely cheap there. But the problem is that a doctor doesn't do the procedure in Turkey.
Right.
The procedures are done by technicians. So you have one doctor who basically oversees maybe 20 or 30 patients being done that day in the same location. Unfortunately, that's not always the best way to go. I do see people that come in my office that have terrible results from those procedures. Once in a while, I see someone who has a decent result. So it really depends on where you go in Turkey, who's doing your procedure. I had a patient last week tell me that they went to Turkey, he came into my office because he had a problem and he wanted me to see. And he said he did the procedure in a room with 12 other people.
Wow. And
all that was separating them on stretchers was curtains, like an emergency room.
Right.
With somebody behind them doing the FUE procedure. Again, not the best way to go and do a procedure for many reasons, including sterility and
sure.
And not only that, but what if there's a problem? Now you're in a room with so many other people and no doctor. Mm-hmm. The doctor is basically walking around seeing other people. So it becomes a real problem.
Yeah. Certainly not the way to do it.
And that's Turkey. It's not the way to do it. But people will go there and they take the chance because they're paying half the price. So all I can do is, when somebody comes into my office, give them the information that they need and tell them it's not the greatest idea, but, it's your decision, obviously.
Yeah, we've seen that sort of thing for years. People have gone to South America for plastic surgery procedures, and this has been shown a million times over. There was even a great TV show called Botched, where two highly trained plastic surgeons in California would repair a lot of the things done in South America because they were done either incorrectly, inappropriately, obviously for less of a fee, but these people were not getting great care. And whether or not a technician was doing a procedure, there was even one program where someone wanted, butt implants, glute implants, and they used a breast implant to put into that space. So when you go somewhere to get a price that may be a little bit better, it may be unfortunate that you're just getting, lesser care or potentially a poor outcome. So it doesn't make sense to go somewhere where you don't understand the quality of the procedure and all the safety measures that need to be in place.
Oh, I agree wholeheartedly. I'm familiar with the show. I mean, I've spent quite a number of years repairing work done by other people,
Right.
even though I will not touch anybody that comes from Turkey, because if they have a problem coming from Turkey, they need to go back to Turkey.
Right.
Because if I try to repair it, then it becomes my problem.
Right. Right.
And that I don't want.
Yeah.
But, there was years ago here in Long Island, along the line of what you're saying, in Long Island, there was a doctor, and I won't mention any names, but it was on the front page of the Daily News
Mm-hmm.
where he was a hair transplant surgeon running a practice, and he had two sanitation workers that were doing part time in his office doing hair transplants.
My God.
And this
That's
was
the craziest
this
thing I've
was
ever heard. Yeah.
Well, you could look it up. Daily
Yeah.
News had it front page because when a doctor was not in the office, they would bring in patients and do their own work.
Wow.
It
Oh my
was
gosh.
it was terrible
What
for
in
the
that
hair
doctor's mind
transplant
would make
people
it
back then.
okay to do that, something like that?
Yeah,
That makes no
yeah.
sense.
So people doing all kinds of crazy things out there, and again, to the patients, to people interested in doing a hair restoration surgery that listening to your program, you have to do your research.
Hmm.
You have to go to somebody who's been doing it for a while, who is hands-on and not selling you a procedure and then bringing in a team from someplace else, which seems to be happening quite a bit today in New York, Long Island, all over the states. So research really, know that you're going to somebody who does only hair restoration surgery and not
Hmm.
going to some place where they're doing 50 million other things, and
Yeah.
hair happens to be one of those things that they're doing.
Or you're doing one patient a day, or that the doctor himself is doing, all the work.
Right.
So the time wise, it takes, at least a couple of hours to do the procedure, correct? If everything is set up, appropriately, and everything is sterile and
Well,
injecting to numb the area, it takes a long time. It's not something that's that quick.
it actually takes all day. I mean, it takes
Yeah.
about 6 to 8 hours to do a typical procedure. Yes. That's why it's important to do one patient at a time rather than three, four patients in the same day, just trying to get people in and
Yeah.
out.
Because the attention is focused on every component of that patient, which makes, all the sense in the world.
Well, it's an artistic procedure as well. And a lot of people don't realize that this is not just a surgical procedure, it's an artistic procedure.
Correct.
That's why so many people getting into this only know how to take out the donor area and make some incisions on top, and that's the end of it. But you really know how to do a hairline, where the hairline belongs, depending on the age of the patient, take other things into consideration, direction of the hair, angle of the hair. All these things are important because
Sure.
the angle and direction of the hair changes as you're going from one area of the scalp to another area of the scalp.
Hmm. Most people have never even thought of or heard of that, so that's important, obviously. What do you think about some of the robotic trends that seem to be happening? People say, "Oh, I think I'm going to go for robotic." I don't know the entirety of that procedure, but I'm not sure that would make.
Well,
Yeah, go ahead.
yeah, I'm very familiar with the robotic procedure. Matter of fact, we had a robot in my Manhattan office and hardly used it. The robot, when we go talk about FUE procedure, as I said earlier, an FUE procedure is basically using a tiny punch to make a tiny hole, and then we take out that follicular unit and put it aside for when we put it on top. There are about at least 6 different machines that do the same exact thing. They're motorized machines, and then there's the robot. The robot does the same thing as the other machines, but the robot sounds sexy.
Hmm.
Oh, I'm going for a robotic hair transplant. Okay. The truth of the matter is that it takes longer to do with using the robot. And with the robot, unfortunately, I've seen too many problems with too much hair loss in the donor area,
Hmm.
where the robot, if the person controlling the robot is not fully familiar with the parameters, what happens is that they take out too much hair from a small area, and that area then becomes see-through.
Hmm.
When the hair grows back, you can see that there's a void area in the
Right.
back of the scalp.
Okay.
And I've seen quite a few of those. So even people that have the robot, and then I know quite a few of them here in New York and as well as other parts of the country, they use it for marketing purposes. They don't use the robot, and they don't use the robot because it takes too long to do.
Hmm.
B, you have to have which if they're going to buy a robot, they'll have somebody that. But the fact that it takes too long to use, a lot of people are just using the rotary motorized machines,
So a
which
handheld
work very
device.
well, by the way,
The handheld
to
device.
do the procedure. Yeah, a handheld device, which works much better, in my opinion.
So typically you would prep the person, maybe shave the area, numb them up, and you could pick the areas that you want to extract those, hair units from. And for people that are trying to get a visual of this, it's maybe not a great comparison, but if you buy a little sapling, you buy a little tree, you buy that tree with good roots, and you put it into the ground and you fertilize it, you do all the best things for it. You want to put that in a perfect environment so the tree will have its best chance to grow. And not much different from putting the hair with its unit of the skin and everything, the gland, etc., into make it take.
Yeah, absolutely. You had asked me about, and I think it's important, why people lose their hair. And, we talked a little bit about female hair loss and different tests you can do to rule out, different diseases, including thyroid and so on. But, and I mentioned that in men, it's usually an issue of androgenetic alopecia. So it's really familial. It's genetic. It's coming from one of your parents or both of your parents. And the root of that is DHT. The culprit is dihydrotestosterone. So we have testosterone that gets converted to this dihydrotestosterone. And this DHT then attacks hairs that are adult hairs and causes what we call miniaturization. So it causes them to become shorter, finer, loose pigment, and they become villous hairs. So when someone sees that, they're feeling their scalp and they see that the hair is very fine compared to other hair behind in the donor or on the side of the head, that is miniaturization. These villous hairs are being attacked by DHT. And our goal is then not only a hair transplant, and I think this is important. A lot of these offices that people go into have salespeople if they're not talking to doctors. And some of the doctors even focus on hair restoration. They focus on, let's do a transplant. I think that that's only 50% of the discussion.
Mm-hmm.
When a patient comes in and is losing hair, not only do we want to talk about hair transplants and what we can do for them, but I think before even getting to that, we want to talk about how do we stop your hair loss?
Mm-hmm.
What do we do to prevent you from losing more hair? Because if you're a young guy or an older guy that's losing hair, and I do a hair transplant, you're going to be happy for a couple of years. But if you continue producing DHT and causing miniaturization and losing more hair, then what's going to happen? You're going to be losing all the hair around what we put in.
Mm-hmm.
You don't lose the hair that we put in because it's not sensitive to DHT, right?
Mm-hmm.
So in order to prevent that, we have to talk about what can we do for prevention? Well, prevention, there are only really 4 things that are FDA approved for prevention. Actually, only 3 of those 4 things are FDA approved for hair. But all these things that you see on the internet to grow hair and rosemary oil and all of that, I mean, I'm not against people using that if they really believe it can work, but there's no studies that show that this stuff works. Things that have been studied and are known to work are minoxidil, And minoxidil, today we not only do the lotion on the scalp, we also do pills in low dose minoxidil. Finasteride, or what it's called by Merck as Propecia, and finasteride are the same thing, finasteride being the chemical name, which is a great drug, works really fantastic. 90% of people on that medication stop losing their hair. But their problem with finasteride is that about 3 or 4% of people have a decrease in sex drive, decrease in their ejaculate. If that happens, they stop the finasteride and everything goes back to normal. Of course, on the internet, you will see people talking all kinds of stuff about finasteride, that its rate of sexual side effects is much higher than what it really is. I have a lot of patients on finasteride, and most of them are doing well. When they do have a side effect, we take them off, everything comes back. PRP, plasma-rich protein, also important, used for many years by plastic surgeons, rather orthopedic surgeons, in athletes that get hurt. Okay, this is your own supply. This is your own blood, which we take blood from you. We put it through a centrifuge. We separate the blood cells from the platelets and the serum and the hormones. And then we take that portion of it and we re-inject it back into your scalp. And it's worked very well. And also laser therapy, laser caps that are getting better and better all the time. You know, you use it 10 minutes a day, 7 minutes a day, depending on the laser cap, and also increases blood flow to your scalp. These are things that can be done simply, and they work in helping you to maintain the hair that you have. So we need to talk about that as well as,
of course,
as well as the surgical aspect.
Yeah, it needs to be done in a comprehensive fashion, I think. And as you say, do the big blood work first, look at the hormones, etc. Then as you're anticipating doing the procedure, make sure that everything else is set up. Of course, testing the dihydrotestosterone and implementing the Propecia and the other meds, and also considering the PRP and the caps makes all the sense in the world, because you want to maintain the hair that's there and not lose that because you haven't added some of these things on board.
Right. Yes.
That's terrific. A lot of excellent information. If people would like to get in touch with you, let's give out your phone number, your office number.
Yes, my office number is 516-354-3876.
Once again, 516-354-3876. Some great, terrific information. I was talking with Frank before. We're working on and getting on. We're already on a big platform called Rumble, and we're trying to get into a midweek program on Rumble where the audience is super vast. So we're going to be taking different interviews that we do and bringing it along to the other platforms as well. So we want to teach as many people, the good information, the right information, as much as possible. Any other comments, closing comments? I think you really need to see a physician who is well-versed, well-educated, well-experienced here in this country, not to go somewhere else where you have no idea what you're getting. And, research it. And you're not going to find that many people.
Yeah. Also ask who's doing the procedure.
Right.
A lot of people assume that the person you're talking to, the doctor you're talking to, is doing the procedure, or if there's a consultant that you're meeting with, I think it's a good idea that you may want to meet the doctor before signing up to do a procedure.
Of course. And to make sure that you're getting that doctor who's done the procedures. And I was about to say, there aren't that many doctors out there who've been doing this in such an excellent way for over 30 years. So you don't want somebody who's just doing it for a year or 2 or 5 years necessarily, because their experience with all the different things that people present with is not the same thing. So once again, Dr. Anthony Malura, phone number is 516-354-3876. Give him a call and speak with his lovely staff. Thank you so much for doing the program today. It was great to see you. All righty.
Great to
Have a
see you,
wonderful
and
day.
thank you again for inviting me.
Always a pleasure. We'll talk to you soon.
All right, bye now.
You got it. Thank you. Great program. Wonderful gentleman. We've known so many people that have gone to him with some terrific results. So, friends, let's see. The phone lines are open, 888-420-9272. If you'd like to call in to ask a question, you could do so right now. 888-420-9272. We'd love to take your comments from Rumble and TikTok and
YouTube,
Spotify and YouTube.
Instagram.
Everywhere.
We do have some questions,
Yes.
but they're obviously hair related.
Sure.
So we'll see how far we can get. We have one saying, I'm African American and I've heard textured hair can be harder to transplant. Is that true?
I don't think the mechanism is that much different. So I think that the follicle unit, and I've seen lots of patients that have had the procedure done, and we've seen a lot of patients that Dr. Malurdo has done. I don't think it's that much different. You know, the hair can be thick or coarse in any individual, but it's the same mechanism. It's just taking the entire unit and placing it into that fertile area so that it survives and has enough blood flow, enough nutrients, et cetera, enough oxygen, dilating blood flow, as we say, with the cap, and blocking the DHT if we need. If you have everything covered, I think it turns out to be a great procedure.
And then we just have another one saying, the procedure looks painful. Do I have to take off time from work?
I don't think that many people take off time from work.
Yeah, and I'll say from someone who, a lot of my family have gotten this, and it looks painful, but according to them, it looks way worse than it is. It definitely looks painful. But
So
I've heard
the thing that makes it the least painful, and I, again, have had a lot of people that have had this done, and I know Dr. Malura's technique because I've had patients that have gone there. When you start to numb the scalp, if you put the first tiny little numbing needle in, and they use a very tiny needle, so you feel a little bit of a pinch, and then they're numbing going forward. Let's say the needle comes in here, and then the numbing agent is pushed forward. The second spot where they inject to put more of the anesthetic in is in the numb spot. So the first needle, you'll feel a little pinch, and as they move that fluid forward, it numbs the area. They wait a moment or two, and then in that numb zone, that little track, they're putting the needle in again. It's already numb, and then pushing that fluid further. So done that way, which is something specific to what Dr. Malura has done, and from what we've seen with patients, that takes away a lot of that pain from recurrent injections into non-numbed area. I think that's a big concern, for most people. They don't want to have pain, but doing it that way, there's very little or no pain at all. Again, you'll feel some discomfort, but just that mechanism of numbing in that fashion makes all the difference in the world.
And then another one just asking, am I too old for a hair transplant? You're in your late 50s? What are you talking about?
No, I don't think you're ever too old. I mean, I see people that have had it done at older age, and why not? I think people, if they wanted to look better and look good, if they want to do it, why not? It's like same with plastic surgery. Some people that want to do it because it makes them feel better. If there's not horrible risk, and there typically isn't, then, why not? The other comments I'll make, too, is that a lot of the patients that I see, when they're going to go for it, we check their full, big 25-page blood test, look at their vitamins, minerals, hormones, get those into the right range. We may not use fish oil, obviously, right before doing the procedure because there's a little bit of blood involved. You can't have aspirin or anti-inflammatories to make your blood thin and bleed a little bit, but we certainly talk about checking the thyroid and correcting that, because if you do the procedure and your hormones and everything else are good, you have a better outcome. If your vitamin levels are great, which is what we create with the new vitamin pack program we're doing, which we'll talk about in a minute. If we get them on the finasteride to block the dihydrotestosterone, or Avodart, dutasteride, another similar mechanism. If we use a minoxidil 2.5 milligram in a tiny little tablet, that could be beneficial. Some people like to use the topical minoxidil, which can be done. And there are companies that make combination oil that you can put on your scalp that's got minoxidil, sometimes retin-A, latanoprost, which is a glaucoma eye drop that also makes your lashes grow. So there are combination things that you might, opt to use. But taking the more permanent hairs from the posterior aspect and putting them to where the hair is thinning and breaking down can make a very big difference. But as Dr. Mueller says, you have to do the entire approach. It makes all the sense in the world.
Got it. And we have a few questions. This was probably before he got into the whole turkey kind of thing, just kind of asking like, oh, like, why is it so cheap here? And is that the move? And I just want to mention, hearing him explain, this is a huge surgeon that does this, probably number one on Long Island, but probably further than that. But for him to say, yeah, you come from Turkey and you need help, like I can't help you. Like, I'm not taking that liability.
Yeah,
I can't imagine a scenario. I understand money is money and you want to go somewhere to save money, but to put yourself in a position where you could come home from Turkey and you may have an issue and all you can do is go back to Turkey.
Yeah, so the thing is, if you have a problem at the time of a procedure and you're meant to go back home the next day or the day after, then what do you do? Do you have to stay there to get someone qualified or a hospital, fix something? It's not worth saving a couple of $1,000s to go do that at the risk of having a problem and then coming back and having to deal with that problem. And the problems could be many. I think that it's always best to go to the most qualified person, to go to someone who's done lots of these procedures, to know somebody who went to that doctor and said, hey, I went to this doctor, had a great outcome. And there are ways that, Care Credit or some of these, credit companies will allow you to pay them back over time, as they pay the doctor, that process, et cetera. And like I've said for many, many years, people go to Mexico for plastic surgery because they're spending less, but you have issues there and something is weeping or a drain, or you can't, I don't want to get into all the different bad side effects from potential surgery, but, you see the problems. A doctor here doesn't want to take on a case that's problematic because if they can't fix what was done by another person, doctor or not, they don't want to take on, again, that liability. And the insurance companies that doctors use for all the insurance tell them strictly, you should not do something where you think there's going to be a bad outcome because then, you're under the gun on that. So it should be done in the safest and the best of circumstances, but people really have to, research and review and find the best doctors to go to.
Yeah, we already have someone in the chat that said they did get it in Turkey and they're dealing with major scarring, and it was a huge regret of theirs.
Well, scarring occurs, and there are some people who scar easier than others. So that's got to be taken into consideration. And honestly, I wouldn't want anybody but the doctor himself to do the procedure.
Yeah, and this person said the clinics don't even show their medical licensing or surgeon credentials.
That's just crazy.
Yeah.
There's a thing called informed consent.
Yeah.
There's also a concept, and what's his name? Elon Musk said something like this when he was interviewed once. Wishful thinking gets a lot of people in trouble. Wishful thinking is, I could go there. It'll be less. I'll get a great procedure. And that wishful thinking, overrides their ability to look at credentials, to look at what's going on.
Think critically.
So you have to really be critical of evaluating something to make sure that you're going to get something that is worthwhile.
Let me see what else. Are there any laws in the United States that protects patients who go abroad for surgery?
No.
There's
no United States law that would say, okay, we have you covered if you go somewhere to unqualified people to do a procedure.
Understandably.
And as I mentioned, that show before, with botched show with Dubrow and Nassif, who are really extremely qualified surgeons. I have friends that know them directly and know their families. But as a physician, you could see how qualified and how excellent their procedures are. And to go somewhere to do a procedure for less money and then to have a problem that is botched and then have to come back and have that fixed, that's a nightmare. And sometimes I look at that program, and again, there's this quality and this surprise and shock and awe of the program that people would go and do that somewhere and take. And plastic surgery, remember, involves a great deal more risk, I think, than just, a hair transplant, whether it's you doing something to your face or any other part of your body. I wouldn't let anybody touch my face in some other country, et cetera. So It's amazing to see how people go beyond common sense and will go do something that is, significant risk.
Yeah, we got this one. It says I had a transplant 10 years ago, and I'm thinning again. Can you do a second transplant, or is there a limit?
You can do second transplants. The only comment initially I would make is that if you did a transplant and they took out a strip, they're taking out probably an inch worth of strip that goes kind of from behind ear to ear. You may not be able to do another or multiple strips because you're shortening your scalp. They may do the individual extraction with the individual hairs with a handheld device. If you're losing hair, then just as Dr. Malur said, and I've been maintaining for years, you've got to look at your vitamins, minerals, hormones, and if the DHT is high, we have to block that. So you stop losing the hair that you have in the central area. There are people, and we put together recommendations for people that they use collagen peptides twice a day, which are good for your hair, your skin, your nails, fine-tuning your vitamins. Vitamin D, research now says vitamin D deficiency may correlate with hair loss. We're always testing and correcting your vitamins, so that would be the first thing to do. Get your test done, your 25-page blood test, see what's going on, fix that, stop your hair from being lost while you're researching, where to go for your procedure. And certainly wholeheartedly recommend Dr. Malura. As you can see, he's a gentleman. He's a terrific doctor. And I know people that have gone to him, so, we endorse him wholeheartedly. But the workup before the procedure is an important thing.
We just have a side comment that said, I always knew rosemary oil was nonsense.
Well, there are people online in social media talking about every possible thing you could imagine because it's a big marketplace now. I'm not saying that all of it is crazy or hogwash, but if you look closely enough at a person's lips when they're talking, sometimes the lips don't match with the voice, and you can see, and even you could hear that these things are, well, we cured 100 people with cancer because, they kissed a frog and used rosemary. I mean, you have to be very...
A lot of snake oil out there.
Skeptical of a lot of that. I'm not saying that it's impossible for someone who might use argan oil or rosemary oil and see some benefit. There's no literature, there's no research on it. There's no comment and sort of what I would call double-blind research on it where they tested something and they tested a placebo and then the person didn't know which one was being used. Then you can say, okay, well, these results are more accurate because there was a study done. But when you don't have studies on the majority of these things, there's no way for any rational person to comment on, benefit. It's like people taking vitamins. Vitamin companies and stores and businesses will sell vitamins and make all sorts of comments that may not be correct or may not be true for you. The only way to understand what to take for vitamins is to look at your blood test, number one, and number two, look at your overall condition and see what other vitamin deficiency symptoms may be there, and look at the entire picture. Then correct the nutrients accordingly. Use great foods, get rid of junk foods. Exercise so you're flooding your cells with oxygen, vitamins, minerals, and hormones. We put together the vitamin pack for you. Here's the perfect entrance into doing that conversation. So for 37 years I've been doing this. Tested every single patient for vitamins and make recommendations. The ease of doing this now and the specificity of making a custom vitamin recommendation is that your blood test will show us exactly what your levels are. Your medical history will give us other information as we put together nutrients for you. I can take a little recipe sheet and click off what I want to be in your morning pack and your evening pack, so it's covering everything we need. If you're low in magnesium, we add more magnesium. If you need more CoQ10 because you have a heart problem, we do that. If you have this or that issue, if you don't methylate, then we'll put the methyl B12 methylfolate in it. If levels of the B vitamins are low, then we'll add to that. If vitamin C needs to be higher. So it really depends. I could make it anything that your condition and your blood test shows, and then you would get a box with an explanation of the nutrients. We'll put that together for you, and you take your pack in the morning and you take your pack in the evening. So it takes all the messiness or the guesswork out of it. Granted, every patient I think I've ever seen has taken vitamins just randomly because someone said this. They walk to a health food store. Someone in the health food store say, oh, do this, do that. It's good for energy, good for, so a lot of that is just nebulous, but I want to make it so that it's factual. If you go to a store and someone gets you on a B12 vitamin or a B complex and you're not absorbing well, your levels aren't going to be good on your blood tests, and that's why you're not getting a result. Maybe you don't convert B12 because you don't have a gene that helps to make an enzyme to convert it. So that's why B12 may not be working for you. For years, doctors have given B12 shots to the older population without knowing that so many of them don't convert. So it has to be methyl B12 that you give in the shot or in the capsule to be able to work, because some people that can't convert cyanocobalamin or hydroxycobalamin into methylcobalamin will not get benefit. It's got to be methylcobalamin. So there are so many individual things that we look at, obviously, to make your best recommendations for your nutrients. Also, to some extent, it saves you a great deal of money because there are people out there coming with a shopping bag full of vitamins. They got 30 bottles of things. And I say to them, why are you taking all these things individually? Because it's creating much more of an expense for you. And we talk to them about using a multivitamin. We talk about a grouping together of nutrients so you're getting a better result with less expense, less nutrients, less bottles, less pills. So it's important, as Dr. Muller was saying, to understand the entire picture relative to hair and hair loss and hair replacement. With any medical condition you have, it's important to really understand the entire picture.
I have this question. I'm not sure if they're referring to vitamins or hair, but she says, is this ever covered by insurance? Seems too good to be true.
Well, hair transplants are not covered by insurance. However, when we see patients, typically, all the blood work that we do is covered by insurance. So depending upon your insurance, you could either draw blood in my office. One of the big labs that we use participates with almost every plan. And if you need to go to a specific lab, then we give you that prescription to take it to that lab. So they bill your insurance. For Medicare, we bill Medicare for office visits. So those office visits are covered, whether they're telehealth or regular visits. And all of the regular insurances like PPOs, where you're allowed to go to any other doctor, you get reimbursed for the visit. The interesting thing is that a lot of insurance companies have made it so that they don't want to pay the doctor either on time or at all. But when you're a patient and you pay the doctor's visit, you get a form, you submit that, you get reimbursed by that insurance company within a couple of weeks because they don't want to lose you as a client. So overwhelmingly, the majority of what we do is covered. But vitamins are not covered. Vitamin IVs are not covered. Oral vitamins are not covered. Some people do have these flex spend accounts that they can use towards that, but most people that go out and buy vitamins on their own are just buying them on their own anyway. So, oral vitamins aren't covered.
Makes sense. All right, what else we got? Covered everything up to this moment.
Okay, let's see what we have here. We have questions about NAD, IGF-1, sermorelin. This is great. An email from a person who probably has been listening to me talk, here and there about some of these things. So NAD, nicotine adenine dinucleotide, is an important component in your body because it's one of the most significant things that takes oxygen, once it gets into your red blood cells across your lungs, and converts it to 36 molecules of energy, ATP. So when we're young and we're making everything and our hormones are great and, we're invincible because we can do all sorts of activity and the next day do it again, you never get tired, you feel great. As you get older and your hormones decline and your NAD production declines, you're not going to feel the same. And you may be tired and achy and your brain function's not great and you have brain fog. I'm not saying that NAD decline is the only cause of brain fog, but just about everybody we put on NAD says, wow, my brain is working fast and sharp and focused again. Brain fog also can be coming from allergy, from viral issues, sinus issues, heavy metal exposure, hormone decline. But at any rate, a lot of people, as we correct the NAD, will start to see that word retrieval, focus, concentration, mood. They want to get up and go and do things. I even have a friend of mine that I play golf with. He made the mistake of telling me that he's focusing better, so his golf game is improving. And I say, I forbid you to use that if we play golf, because I don't want him to beat me senselessly as he does anyway, because he's a terrific golfer. And he's been playing for a very long time. He's probably a 3 handicap. and he's tall, and Frankie knows who I'm talking about without naming anybody. He's about 6'5", and I've seen people hit the ball, and I thought I hit the ball pretty well. He consistently, when we played a week or so ago, was hitting drives 340, 350, hit one that was 360 yards. So I said, this is just a different game because all he has to do is just pop it up on the green, so
Game over.
it is what it is. But he loves the NAD. And everybody that we talk about with the NAD and that starts it, love it because they feel great with it. They feel that great energy and mood, which is what your body's always had. And one of the bigger things I talk about is we're not throwing stuff at you that your body's never had. We don't throw meds at you unless, of course, you've got a horrible blood pressure issue. We want to get that down while we're fixing things. But giving you vitamins, minerals, correcting thyroid, DHEA, testosterone, IGF-1, NAD, each of these things your body's always had. So it adapts back to when you had good levels and you have your significant improvement with that.
Got a question here just asking, are those NAD plus supplements you see online actually effective, or do you need IV therapy to really feel the benefits?
Great question. Everyone asks that. The supplements you're getting are not NAD. You're getting a precursor, or you're getting something that's somewhere peripherally in that biochemical picture. So you're not getting direct NAD. When we do injectable, because we don't really recommend to go for the IV because of the expense, places in the city are charging an arm and a leg for that, which there's no need for that. When you get the bottle of NAD, which we order for you and teach you how to do it, you give yourself a little sub-Q shot in your belly or your leg, and you start every other day. Some people do so well that they want to do it every day. But that bottle might last 3 or so months, and it's a fraction of the cost of even what one IV might be. In the city, they're charging $900 to $1,200 for an IV. There's no reason for that. If you're getting the bottle, it's a fraction of that cost, and you have it every day over the course of months, which will give you a far better result. So there's also a little bit of a learning curve on some of these things, just as I'm explaining to you, because those precursor things that they're touting and everyone's raving about, I've seen people try them because, people love this leap of faith to buy the vitamin that is being sold all over the place, or that substance being sold, and they come in and say, oh, well, how's it working? I don't know. How long have you been using it? 6 months. Well, if you're not seeing a result in 6 months, it's not working. The other comment I've made for many years is that I've got a pretty great experience in understanding what works and what doesn't work, because I've had thousands and thousands and thousands of patients over 37 years that take different things on their own and just tell me whether they're working or not. So I know what works and what tends not to work and why. So that's why we put together recommendations that are ultimately specific for you and will not involve some of these theoretical things. When we talk about peptides, and NAD is one of the best, and sermorelin, IGF-1, etc., there are many peptides that we don't recommend because I haven't seen results with patients that have tried them through, getting them online or getting them here, there, or anywhere else. So that's why we use the things that we see results with. I don't want people to go out and spend money on something if they're not going to get a result for it. I'm not against them trying it, but if you try it, it doesn't work, what's the point?
And this question, what is the difference between niacin, NR, NMN, and NAD? It's very confusing.
Well, niacin's a vitamin, and that, years ago, people were taking lots of vitamin because they were told it lowers cholesterol, but people get this weird flush reaction, like you'd have sunburn. People would freak out because they get all itchy and red, and, they would go nuts. And we never recommended it in the doses that people wanted to take it for. Again, it was just an ill-advised recommendation. Small amounts are okay, but we never did that. NMN is within that realm of the precursors of NAD, but I have yet to see someone who's taken it that says, yeah, I'm feeling this. And besides that, the people who've done these precursors that have taken the NAD shot say, wow, within 20 minutes, they feel it. So that's why we only recommend the injectable as opposed to taking an oral precursor, which is not giving you NAD. To some extent, too, and this holds true for another substance, glutathione is a great free radical scavenger. And glutathione is touted all over the internet, blah, blah, blah. People taking oral glutathione never really say that they're feeling better, better focus, et cetera, because oral glutathione will be destroyed by your digestive acid in your stomach. A lot of things are broken down by your acid, your enzymes in your stomach, and don't really work. So when we do glutathione, we do IV glutathione because that's great. And we've seen Parkinson's patients have a significant decrease in their tremor by doing intravenous glutathione. I also use combinations of 2 IV bags, phosphatidylcholine and glutathione, which literature has described to be beneficial for memory, focus, brain function. It also can help to bind to metals, pesticides, chemicals. There's literature on that. So using it orally, it's just not going to work. Intravenously, it's 100% absorbed. That's the big difference between an oral and an intravenous mechanism.
I'm learning a lot.
So much information to talk about. It boggles the mind. But, I try to explain things in simple terms so people can understand it. People could take advantage of, learning about their body. I mean, nothing is better than learning about every mechanism or component in your body and adapting and correcting and fixing, which makes all the sense in the world.
And this question says, does boosting NAD actually improve long-term energy and health span? Or I guess they're asking, do you have to continue to take it?
Yeah, in order to maintain and continue benefit, you should. Not everybody will do it every day. Some people do it every other day. Some people do it every couple of days. There is research on it that talks about it repairing DNA, repairing different components of your body. So you could look up NAD and DNA repair. You could look up NAD and energy or mitochondrial benefit. The literature's there. So it's hard for me to run down an entire list of everything that we know NAD correlates with, but it's easy to look up. I tell people to go on Google Scholar. That's the research engine of Google. And you can find literally millions and millions of studies about vitamins on there. I think vitamin C has 4 million. Vitamin D may has 4 or 5 million. NAD, there's a ton of research. I talk about vitamin C IVs, intravenous vitamins therapy. In the search box is 1,500,000-600,000 studies. So I tell all my patients to look at Google Scholar to gather this information because they come back and saying, wow, I saw this, I saw that. And sometimes people will just come in and bring in cool articles. And I'll put them up on the inside of the exam room so people can read them. So, yeah.
Pretty good.
Let's go to another question. A gentleman with low testosterone and also wants to ask about his wife with testosterone. So men and women all need testosterone. When you're young as a male, you have levels that are super high as you're growing, and it's great for endurance, strength, energy, sexual drive and function, maturation, of course. When young kids have too much, they'll get acne, so that's not unusual. But as you get older, when those levels drop, you're losing a lot of that ability and function. So we can walk you back with correcting testosterone as an older person. And sometimes men in their 40s and 50s have a significant drop. You want that level to be around 600-700. And some of them come in at 300 or 200. We can do a shot once a week for a few weeks to get your levels to come up. That you'll feel quickly. Then we can switch over to a pellet under your tongue that dissolves, a cream on your arm, or even placing pellets under your skin so that it's there for 6 months. So there are different ways to do this, depending upon what the need or the requirement would be. In the same comprehensive nature, or vein, no pun intended, when we recommend vitamins, minerals, and hormones, we want people to do the exercise. Some people do a little, some people do a lot. We try to get them to do as much as they can because that more dramatically will burn fat, burn sugar, burn cholesterol, give you great muscle strength. All of these things occur when everything is hitting on all cylinders. So that's why it's a discussion on each of these areas. Women need testosterone too. Their levels should be 40 to 50. They don't need to be higher than that. And that prevents osteoporosis. That's great for mood, memory, sexual drive, and function. So as we get older, in our 40s and beyond, we start to drop the hormones. We're just bringing them back to where they were before.
So you could put topically a cream, and that's going to boost your...
The topical testosterone cream will absorb and give you some testosterone for the day. It doesn't last a week like the injectable form of testosterone, wouldn't last 6 months like the pellet implant. So it depends upon a person's need or want. But you want your levels to be in a good range so your body regains that function that you've lost.
Right through that epidermis, all right? I didn't
Yep.
go to medical school, but I know a couple things. All right, let me just check out the chat over here. What do we got? So can you explain the interaction between NAD and things like thyroid or adrenal hormones? Could low NAD be part of a bigger fatigue picture?
So the easiest way to answer the fatigue picture is that it could be caused by 50 things. So just in terms of most common causes of fatigue, and it might be a little bit different for different segments of the population. So let's say the younger population, preteens, teens, 20s, for men, because they're in connection or contact with lots of other young people, very, very high on that ladder would be Epstein-Barr virus. We call it mono. So we test for that all the time in younger and older population, but that's high on the list for the younger population of fatigue, just like it would be for young women. But a young woman also, because of having their period and blood loss and iron loss, might have iron deficiency as one of the top reasons for having fatigue. You don't see teenagers often have low thyroid or low estrogen, progesterone, or testosterone. Typically that occurs a little bit older. However, I have patients that have been in their 20s that have low T3 because the family genetically has some thyroid issue and has low thyroid, and we've been able to correct that. So as you get older, the hormone decline becomes a little bit more significant. So low thyroid probably happens more often in the late 20s, but absolutely 30s, 40s, 50s, 60s, for men and women. Testosterone for men can do that, and it drops down at some point, probably by the late 30s or 40s, and then more so 50s, 60s. Same thing with women and the testosterone. So it depends upon the age and what we are seeing within that blood test. Your body tries to repair itself. So when you're young, you have lots of IGF-1, which is the active component of growth hormone. It creates your height and your mass. When you're a kid up to age 19, when your bones close, you can't grow any taller, etc. But IGF-1 is good for sleep, memory, focus, energy, mood, endurance, and strength with exercise and muscle activity. So if that's going to go down, you're going to feel tired. For people of all ages, if you don't have enough B12 or your minerals or your B vitamins, you'll be tired. And in that B12 issue could be people that have high B12 in their blood, but they don't convert the B12, as I mentioned before, like the methylation mechanism. So they're not getting any methyl B12, and that's why they're tired. So there are many components of this. If you look at NAD, the same thing. You're not going to see young people that have low NAD. This typically occurs as you get older. And when you're bringing back the things that people have lost, and this is kind of like clockwork, I'm not going to say it happens the moment you correct something, but there are people who have the defect of the methyl B12. When we see that on their blood test at the second visit when I review everything, and we give them a nice shot of methyl B12, within that day or so, they say, wow, I felt alert, I felt great. It didn't last for more than 3 days, but I felt it. They have to document that, write that down, if that's one of the only things they're dealing with. So we want people to give us feedback so we can know with what we found and with what the recommendation worked. For people that have viruses, then we typically do the vitamin C IVs, because there's a lot of literature on that. I mentioned before, 1,500,000-600,000 studies talking about intravenous vitamin C helping to inhibit cancers. That's one of the combined therapies that doctors will do. It also helps to inhibit virus. We know that. Inhibit sepsis, Epstein-Barr, COVID, herpes virus, shingles. So we know that, and we put that together for people of all ages. So interestingly, when we do the NAD and people come into the office and we've ordered it and we start their program and I showed them how to do it, even within 15, 20 minutes or so, maybe a half hour of that first NAD shot, people say, wow, I feel more alert or more focused. My word retrieval is better. I feel good. And as they continue to take it, that good continues. It stays. So will the NED help other things? According to literature that I've seen, we've got a big handout. I don't think I have it here, but I'll bring it next time. It talks about repairing cellular function, repairing DNA. So yes, it does repair other things. Will the NAD be enough to fix a thyroid where the thyroid gland has lost cells and gotten tired, is not making T3 and T4 as much anymore? Probably not. I wouldn't take NAD to expect that to completely repair a factory that's been closing down for a while. In most cases, when we see that, we correct the thyroid. So I think all of these things go hand in hand. That's how we have to think of it. They all have their own job and some things overlap. And of course, NAD is good for energy and mood. So is thyroid, so is DHA, so testosterone, IGF-1. So we have to look at it in a comprehensive fashion. But good question.
We have a thank you from that question. But you're welcome,
You're welcome,
Suzanne.
I hope I was able to answer it without making it too complicated or confusing. That's why I don't like to use big words. Only when I play Scrabble with my friends. I don't play Scrabble anymore, but when I used to, I have more medical words that allow me to win.
These doctors can never win. Scrabble, you kidding me? I'm just going through all our different chats. Through that. Good there. All right. Quieting down.
It's okay. So for people who are not near the office and can't easily get to the office, we offer telehealth visits. So we're doing a lot of that now. We also hired a lovely young lady, a nurse practitioner with great experience, to work in the office and help me with a few things. For those people who are healthy and relatively well, who just want to get their vitamins fine-tuned, we could do a vitamin consultation with them. We'd call the office, you'd do a telehealth visit. We would send a lab if we can, or send a prescription for you to get your blood work done. And then within a week, as that comes back, go over that with you, and then put together recommendations for that vitamin pack. We're getting calls, we're getting emails for this, and I thought I'd come out and start mentioning this because everybody's asking about it. So you could live far away. And uniquely, because regular doctors never, ever, ever do this, they don't care about vitamins nor want you to take vitamins, you can set up the telehealth visit with the office. We'll get that set up, get your blood work done, and get you on your nutrients. So it makes the ultimate custom specified vitamin combination based upon your blood test and based upon your needs or your medical condition. We also, obviously, could correct other things like hormones, NAD, etc. So we can do a variety of things. So we're making that available to everybody. We'll announce that today, tomorrow, on the big show, the really, really big show on Saturday. A really big show. Not that many people are going to understand that reference. The really big show. Young people might not.
But shout out to LFA, which we will be on tomorrow.
Yes, LFA, our big platform.
Let's
Getting
go.
crazy views on LFA.
And listen, if you're watching the show right now on Rumble, check us out on YouTube. If you're checking us out on YouTube, check out Rumble. Check us out on Apple Podcast. We're everywhere. The Optimal Health Program. All right?
All over the place. Tomorrow at 2:30, we'll be doing another program. I have a few more patients to interview. One lovely lady who's been coming to me for years, hadn't been in a while, a couple of years, and her daughter always comes in with her, and her daughter's great. She keeps her mom on track. It's like the daughter's the mom instead of the mom being the daughter now because she's taking care of her mom. She has some issues. She had COPD and problems with that, difficulty walking, couldn't breathe. So a few weeks ago, we did stem cell therapy on her. And within 2 days, and we follow people up every month. Usually the first follow-up is 3 weeks later. The daughter will come back and say, hey, my mom is doing great. She's breathing. She could walk further. And she was using a wheelchair to get around, to a doctor's office or if she had to go a distance. And around the house using a walker and a cane, etc. She said she hasn't used the walker or the cane. She goes, I don't understand. I said, what do you mean? She goes, she's breathing better and she's more mobile. I said, well, that's what stem cell can do. She goes, but that's soon. I said, there's nothing else that you're doing. And we've seen it before in lots of patients. And then progressively, I've made it a point to talk to her week to week. I talked to her the other day. And she can walk whatever distance now. Her breathing's great. She's not on as many meds. So I'm going to have them on here to talk to us and tell us how well she's doing.
Oh, that'll be awesome.
Yeah, it's pretty amazing how your body can repair itself. But that's what we're all about.
Let's go. Let's go.
We talk about Alzheimer's, arthritis, COPD, diabetes, erectile dysfunction, heart failure, kidney failure, liver failure, lupus, MS, Parkinson's, stroke, pulmonary fibrosis, macular degeneration in the eye, diabetic retinopathy. All of the areas of damage and degeneration is what your stem cells would love to go and repair. So that's why we've been doing it for so long. And there are huge numbers of studies on stem cells worldwide. I just think that there are interests that don't want it to come along and become a primary therapy because then everything else gets pushed to the wayside, including meds.
Or most importantly, meds.
We have lots of articles up on the cabinets inside my exam room. I don't want to plaster them all over the office and make it look cheesy, but they have them on the cabinets, the back of the door of the exam rooms. One article, mesenchymal stem cell therapy, helping with traumatic brain injury. We've shown people that. Cluster headache video on YouTube as well as on the website. Gentleman blown up in a vehicle in Afghanistan, and we're treating veterans again, continuing. Cardiac stem cell therapy after heart attack to repair heart damage. Stem cell therapy benefits for people that have plaque in their blood vessels to repair the lining, decrease some of the plaque, progression. Just great stuff. And that's why I want to keep putting this information out there for everybody to hear about.
Huge.
All righty.
Not a bad program, huh?
Pretty good. Looks like we're down to the end of the program. Thank you for listening. Friends, keep sending us messages and emails to the office. drcalapai.com is the website. I keep forgetting to give out the website.
It's up.
drcalapai.com. Garden City office is 516-794-0404. Call us with your questions, and we'd love to help you out. Telemedicine, all the new and great different things that we're doing. We'd love to introduce you to the vitamin packs as well. So always trying to manage and fine-tune and fix and improve, be on the cutting edge for recommendations, make you as healthy as humanly possible. God bless you all. Have an amazing day. We're back here tomorrow. I was going to say have a great weekend. We're back here tomorrow at 2:30 with some more cool stuff. I will promise to have a new and exciting pocket square. I was telling Frankie I bought this little device that holds your pocket square in perfect position. I think every man should
We're
get
expecting
this.
some artwork tomorrow, though.
Yes, some beautiful pocket square action tomorrow. And we'd love to hear from you and see you then. Thank you. Bye-bye now.